podcast. I'm Tim Niemeyer. Today, I am joined by Andy Schoonover, CEO of CrowdHealth. Andy, thank you for joining me on Zoom Out.
Yeah, thanks for having me.
Andy and I met down in Miami last year at the CrowdHealth gathering, and I absolutely love that. I've been a CrowdHealth member for, about a year and a half now, and I'm so glad that you've come on to talk to us about it, because this is something that everybody needs to hear, everybody needs to consider. So before we get into CrowdHealth, in addition to being CEO, you're also a Bitcoiner.
Mm-hmm.
I always like to kind of start out, just a quick little backstory of you. How did you get into Bitcoin?
My first encounter with it was probably about 10 or 12 years ago. I think it was probably 2013 is my guess. And I think I just heard it through kind of the entrepreneurial circles. And so I wanted to get in. And so I talked to my buddy about it. And he's like, man, this is the dumbest thing ever. That's, the government's going to get rid of this. No way. Same things that you actually hear, 10 years now. And so I didn't. And I don't remember exactly what it was, but I think it was like $200, something like that, around there. And I was just like, I'm going to put $10,000 in it. He's like, no, you're a dummy. So I didn't. Because I think right after that, it went from like 200 to like 800. I'm gonna get the numbers a little bit wrong. But I was like, oh, I missed it. I missed the boat. And here we are today. Last time I checked, above 70,000. So,
and I just had a conversation with somebody who was saying they missed the boat. But
yeah. Well, and so what can I say? I got in a real way about 3 years ago. So, fortunately, I got in when it was in the low. I think my basis is in the mid 20s somewhere, mid to low 20s. So I'm feeling pretty good at it being at 70. So
was it? Does that put you around COVID? Is that about? Was that the catalyst?
It was around COVID. Yeah, I mean, I think that the COVID did kind of outline or highlight a bunch of things that I think a lot of Bitcoiners really kind of tag themselves to, which is, from my perspective, and I think you probably agree with me, that the government is probably more interested in control than protection. And I saw that very, very clearly with COVID, and just seeing the destruction, firsthand with, close friends and family members of just being destroyed because sorry about that.
You can come on. You can have a little thought.
Yeah, I got two pups out at the house today, so I apologize that. But ultimately, what I saw there is there's a lot of destruction of value as a result of government intervention, and I'm seeing that in the monetary system too. So you've got it in the healthcare system with COVID, which is kind of a very acute example. And then you see it in the monetary system too. And I'm just like, man, I just can't trust the government to do what's best for me and my family. And so, I need to invest in something that is government free. And, Bitcoin kind of came back up in conversations. And I was like, man, I need to take a look at this, a little bit closer. And so, made a, fairly substantial investment in it, back in 2020 or 2021, something like that. So it's been a good run.
You said the phrase control over protection, and I don't want to jump too far ahead, but geez, that's about what it is really. It's almost control under the guise of protection. If never let a good crisis go to waste, so to speak.
Yeah, famous saying, right?
Yeah, they see that.
Ron Emanuel, I think, was one that said that a ways back.
Exactly. So if that's right around 2020-ish, CrowdHealth, when did that start, before or after that?
We started in 2021.
So it's just that kind of the Bitcoin journey, it kind of opened your eyes to this.
Mm-hmm.
And that kind of led you down the rabbit hole towards CrowdHealth?
There's kind of a confluence of events, I think. Around the same time, I had sold my previous company. Didn't have health insurance, because most of us get health insurance through our company or employers. And so I was looking for other things, and was like, man, guess my only option is to go get an Affordable Care Act plan. And so I started doing that. It was like $1,200 and $1,200 a month for me, my wife, and my two girls with a monster deductible.
Oof.
And I was like, all right, well, I got to get this. And I kind of joke it worked until I had to use it. So, my little one, who was 1 at the time, was having recurring ear infections. And so she went to the ear, nose, and throat doctor, and he said that she's got a hole in her eardrum, a perforated eardrum. And so we went to the local hospital. It was the only place in town that was do this procedure in network. And we got the bill, and it was $8,000. And I was just blown away by the fact that a 15-minute procedure, I think my wife and daughter were in the hospital for a total of 45 minutes, was like $8,000, and I'm like, that's crazy. I was like, okay, well, this is what health insurance is for. Like, this is the whole point. And then I got a note a little bit later by my health insurance plan that they weren't going to pay for it because it was medically unnecessary. And so, again, I was kind of at this point of being like, these big organizations are not for me. They are, against me. And so I'm not interested in partaking in their games. And so I quit health insurance. I've been uninsured ever since. So that was early 20. I was maybe late 20. I was through my deductible already. So it must have been late 20, something around there. And so that was kind of what kind of led me to this like path of trying to figure out like, how do we take our healthcare back, and so it was more kind of like COVID was starting, that occurred, kind of all these things kind of were happening. I'm kind of like, there's a great distrust of large organizations and their, mission to protect me looked a lot more like a mission to control me. So that's kind of what the impetus was for starting the company.
Before you describe CrowdHealth, you actually, I think it was a few years ago, you or somebody, it was a podcast I was listening to that kind of really got me to think about, why this is important. And like CrowdHealth is the idea behind it isn't new. I remember hearing you say something like, think about old churches back in the day, how they used to gather funds together. And then when somebody was in trouble, the church would help. They would that pool of money. So
the Amish to this day still do that.
Is that right?
Mm-hmm.
So with that in mind, could you kind of describe to the listener CrowdHealth, if this is the first time they're hearing about it?
Yeah, like you said, back in the day, churches or even just communities, like agricultural communities, if somebody needed help, they would all gather around them and help out. And, unfortunately, in our modern day culture, if somebody moves into our community, we're a lot more interested in what they paid for their house as kind of a determinant of what our house is now worth, as opposed to welcoming them into the community with, I remember 30 or 40 years ago, like you'd have cookies or something, like welcome neighbors into the community. We just kind of lost that community sense. And so I just think so it's innate in us that we want to be a part of a community. Like I believe we do. And so, how do we create a community who is actually willing to help each other in the event of something, big happening? And, that's what I want to do. So in essence, what happens is you're a part of a community with me, so that if I get hurt, Tim is willing to step up and say, hey, Andy, I'll help you out, with your bills. And as long as I'm a good member of the community, like I'm helping out other people, then, almost 100% of the time, or actually, in fact, 100% of the time, if I'm helping other people have shown a willingness to help me within the CrowdHealth community. And so we're really just trying to build this community of people who are willing to work outside of the existing health insurance kind of market, right? The exist outside of the medical industrial complex to help each other in communities, which is, how it's been for, thousands of years. I mean, since human existence, we've all been part of tribes, and we've lost that.
It's the incentives, the positive incentives in doing that, that really make this work. And those incentives inside that healthcare industrial complex, that control over protection that you mentioned, there's a lot of disincentives. It's like,
They're seeing perverse,
and this is anecdotal, but I'm seeing a lot of unhealthy people coming from that system. It's not promoting good health.
Mm-hmm.
It's not preventative. And it's almost like you're not the customer. You're part of you're just helping them stay in business as opposed to them helping you get healthy. There's no money in a healthy person, right?
Right. Yeah, no, for sure. And I think that, if you're not responsible for your own healthcare bills, then you are going to not be nearly as incentivized to take care of yourself. I mean, that's just life from my perspective is about incentives. And unfortunately, with the insurance, space, the incentives are perverse. And we can talk about more of this if you want to, but like insurance companies actually have an incentive to see the price go up. They are supposed to be our agent to go and out and find us the best prices possible. But in fact, they have an incentive to see prices go up, and so that's one of the screwy parts of healthcare is we have a principal agent problem here where the agent is actually not working on our behalf. The agent is working against us.
Well,
Right.
and you say, and we talk about disincentives. So the doctor, I should be the patient. The patient should be the one that they're thinking the most of. And not saying
Yeah.
that all doctors don't, but they get paid more when they make more prescriptions, right?
Yeah.
So right there, it's like they have that other incentive aside from me having good health.
Yeah.
In a lot of those prescriptions, like you watch any of those commercials, they have the very quick tagline at the bottom with all of the side effects caused. So there is no, I'm not saying no, but the positive incentives aren't aligned.
Exactly.
Yeah.
Yeah. Yeah. And in the insurance plan, if you think about this, like they are actually legally limited to how much of the premium they can use for profit. So, it's 15%, it's 20% in some situations, but let's just say 15%. So, if you have $1,000 premium, the max they can make is $150. So how do they increase that $150 by 10%, or 150 to 165? Well, they need to increase the premium from 1,000 to 1,100, right? So they actually have an incentive for premiums to go up. And so that's what's really screwy about healthcare. Health insurance plans are the primary buyers of healthcare. They're buying on your behalf, and the hospital systems are the primary sellers of healthcare. So when you have the buyer of healthcare and the seller of healthcare both wanting the price to go up, guess what? The price is going to go up, right? So, this doesn't take an economics PhD to figure out why, healthcare costs are going up. All the incentives are for the healthcare costs to go up, and who loses? It's the consumer. Yet the government, both state and federal, just depending on the case, are all putting all these regulations around health insurance to protect us. But in fact, what they're doing is they are hurting us because they are creating incentives for the health insurance plans and the hospital systems to see prices rise. That's just a tragedy from my perspective.
Well, and another aspect to that is, and I saw a chart like pre to post COVID where you look at the number of doctors in the system versus the number of administrators in the system, and the doctors didn't really budge, but you look at the the administrators.
It's a hockey stick.
And what does that do? That's just inflationary pressure that furthers what you were talking about. Who pays for that? We do.
Yeah. Yeah. Well, I mean, look, the primary reason why CrowdHealth works is, in essence, what we're trying to do is enable you to pay cash for your services. And what that does is, what you just said is like all the administration gets ripped out if you pay in cash, because all that administration is to bill health insurance plans. And so when you show up with a credit card and say, hey, I'm going to pay on my credit card, and that's 1.5% or 2% or something like that transaction fee, that is significantly less than the 30 or 40% transaction fees that the doctors are paying to bill health insurance. So they're spending on average 1 day a week fighting with health insurance plans. They have 3 billing people per doctor to actually bill the health insurance plans. And so what if it gets back to a doctor-patient relationship where I'm paying you for the services rendered at the point of care with a credit card, debit card, Bitcoin, with very low transaction fees? That is a much more efficient way of transacting than having to go through a third party and the doctors love it. I mean, they're basically saying, look, I'm going to give you great rates because I don't have to deal with health insurance. And they call us every day being like, please, will you send us more patients because we want to get off of health insurance. We want to do cash pay only. And so what we're trying to do is facilitate a cash payment system within healthcare that rivals the health insurance system.
Well, and one thing I love about it, and by the way, full disclosure, like I said, I've been with CrowdHealth for a year and a half, and I absolutely love it. It's like technology is meant to be deflationary, right? And
yes,
you're leveraging that. You're building positive incentives into a system using technology that basically wipes out all of the middlemen. There's no need for that. And if I can share just a quick story of my pre and post journey. I remember the year before I joined, I fought for 6 months to try and just get a scope on my right shoulder, workout injury, kind of thing. And I got to finally get to see a specialist, and then they say, okay, we're going to give you, the scope, we're going to check it out. And then my insurance kicks back no. And then I try to appeal. And I go through this for literally like 6 months, nothing. And I spent all of this time and all this money going here and doing this. I joined CrowdHealth. I have, what was it? I want to say like a tendonitis something, I go in. No, it was my shoulder. Yeah. I go in right away. It got better. Then it got worse. And I went in right away. I'm already a CrowdHealth member. And I see a doctor. Within a week, I get my scan. Don't have to worry about any of the insurance. And I pay for it like a week later. And I feel like the bill, I'm not an expert in healthcare and I can't understand anything on the insurance side, but I feel like my bill was a lot less.
Yeah.
So it's like, well, that's pretty, why would I go back? I don't know.
I have had a weird pain in my chest. It ended up being a pinched nerve, but I just went and got an echocardiogram, a stress echo. And some guy, and I was like, I got it for under $200. And some guy on Twitter, I kind of mentioned this on Twitter, like the great things that you can do paying in cash. He's like, his health insurance plan paid, I think it was like $6,000 for it. I paid $200. They paid $6,000 for the exact same thing. There was no difference. We both had stress echo tests, and it was just like, this is ludicrous, and the crazy thing is, and you just mentioned it, Tim, it's like, if you have something going on, you have to fight your health insurance plan, right? It's like a battle. And it's like, why wouldn't you want an ally in your healthcare as opposed to an enemy? And that's what we're trying to do with CrowdHealth is we want to be like, we're fighting for you to get your bills paid. The health insurance plans are fighting against you to get your bills paid. It's a totally different dynamic.
Well, not only that, it's like the idea of you don't know what you're going to pay.
That's true.
There's no, I mean, and then when you try and ask them about it, it's like pulling teeth trying to figure that out. I may be jumping ahead, and this may be out of the scope of this conversation, but so I'm a teacher by day, right? And the way our system is set up is that here's what you make, and we have this much set aside for healthcare. But if you don't use it for what we say the healthcare is, you don't get that amount. So technically, I'm paying a premium. I'm losing that amount out of my paycheck because I'm not choosing the employer-defined healthcare. Hey, y'all. Are you need a Bitcoin? You looking for a way to safely and securely store your Bitcoin? Check out the Bitcoin Advisors. These Bitcoiners are professionals that will provide you peace of mind so you can sleep soundly at night knowing your Bitcoin is safe. Remember to tell them Zoom Out sent you. I try and share with people this concept of CrowdHealth, and it's almost like I'm speaking a different language. and there's also that they've kind of built in that incentive to use theirs, because then if you're not using it, then you lose that amount, right? But do you run across this in your business where people in either public education, or not public education, but public service jobs where they have that state-defined healthcare I don't even know. The question I'm asking is like, how can we get away from that? on a grand scale? How can we get away from being forced into the system, I guess?
Yeah. I mean, I think given you are a government employee, I'm assuming, you're at a public
State
school?
employee.
Yeah, you're a state employee. Hard.
Which they do a great job. I love the school.
No, we're not ripping on public education at all.
Not at all.
It's much easier if you are in a private industry to get away.
Yeah.
We've had probably 25% of our people come to us from their employer and ditching their employer insurance, and some of them are actually getting paid for that. So Kaiser Family Foundation came out with the average commercial health plan costing a total of $24,000 for a family of four. A family of four in CrowdHealth pays about $600 a month, so that's $7,200 a year. So 26,000 versus 7,000, there's a pretty big delta there. Let's just call it 20,000. Some of our members have gone to their employer and say, listen, I know you're going to pay a lot of money if I'm on your health insurance plan. Let's just say, you're going to pay $15,000 or something like that on my health insurance plan, but their portion, the employer's portion. What if you give me $7,000? You keep the $8,000 difference. I'll pay taxes on the $7,000, and that becomes $4,500 or something, right? And people are actually doing that. So they're actually getting paid by their employer not to take the health insurance, and they're coming over to CrowdHealth and getting it for substantially less than their employer. And so, in essence, what I want to do is I don't think the employers have any business to be in our health. Like, that just shouldn't be their business. Like, they should pay us what we're worth and let us go out and find a health insurance plan or CrowdHealth or whatever, right? Let us do it. Let them, and therefore we would create some market forces there to reduce, healthcare prices. But since the employers pay it, it just doesn't work. So we're trying to rip people out of the employer space so that ultimately I think this employer space is going to be untenable. Like, it's just not going to be viable. And so, that's really what we're trying to do is pull people out of employers.
There's a non-monetary aspect to this that we really haven't dug into yet. And it's like, I've noticed anecdotally, personally, N of one, whatever, my health has improved dramatically. And it goes back to that incentive, right? Like, I'm incentivized to be healthy, to do preventative, food is medicine, exercise, all of those, do the proof of work, that low time preference. I would think there would be a benefit to employers having healthier employees, having less time off, due to medical needs, right? I'm speaking for myself, but you see that as well. You see a lot of those positive benefits.
For sure.
Dig into that at all?
Yeah, I mean, it's anecdotal a little bit, but like, we've got people who, we have a weight limit. So if you're over, I think it's 260, maybe it's 240, I can't remember. You can't join CrowdHealth. And so we've had people who were above that and then drop below that to get onto CrowdHealth. And I just had a guy, I don't know, maybe 6 months ago, who's like, hey man, I was over 300 pounds and now I'm, closer to 220. I just ran my first, triathlon. My wife is doing it with me. Like, they are improving their health as a result of feeling like they're more responsible for it. I think the other thing too is, like, now if you are unhealthy, you're not just taking money away from United Healthcare. You're taking away money from Tim and Andy, who you're going to be asking to help if you have a health issue, right? It becomes a little bit more personal. I mean, I think the biggest difference between us and health insurance is that we know exactly where our money is going. As you know, I reach out to you once a month and say, hey, Tim, will you help, the Smith family with a pregnancy or something like that, right? And you can say yes or no. If you say yes, then money, goes from your account to the Smith's family's account. And exactly you're helping this family with a pregnancy. Like, that's a pretty powerful thing, as opposed to sending it to United Healthcare. And who knows what they're doing with it, right? Who knows what they're paying for? Not to mention, the CEO of United Healthcare is making tens of millions, maybe even hundreds of millions of dollars a year, with in compensation. So it's just a different way of doing it that I think is behaviorally impacting the community as well. One more quick story. We had a guy with colon cancer who, it's colon cancer, as is like, it's brutal, right? And he's like, look, I want to take care of this colon cancer. I want to find the best doctors possible, but I want you all to help me find doctors that are a reasonable cost because I don't want to screw the crowd. And so I was like, what? Like, what a crazy thing to say. Like you would never do that with, being a part of a big corporate health plan. So we are seeing a lot of that, people changing their behaviors as a result of being a part of the community.
Well, I'm kind of sticking with the anecdotal here, but there's a large crossover between what we're talking about here and Bitcoin. Like I'm not going to be able to say how much of my health improvement has been from CrowdHealth or from Bitcoin, but in the Bitcoin community, you see a lot of personal changes for the better. That low time preference, like I mentioned, the proof of work.
Mm-hmm.
I'm not a full out carnivore, but I've gotten more eating meat and single ingredient foods, and like really, really dialing everything in. I haven't felt better. I assume you have that. You have that as well, right?
Same here. I mean, I think I lost 35 pounds, something like that. From just starting with keto, getting into Bitcoin, getting into CrowdHealth, like all of these things are good forces on life that I think really do incentivize you to take better care of yourself. CrowdHealth wouldn't be around if people actually took care of themselves. We spend like $4.6 trillion a year on healthcare. $1 trillion of that is on diabetes, and most of that is type 2 diabetes. It's crazy. And these are ones where if you like get into a low carb lifestyle, you can get rid of type 2 diabetes in most cases.
It's like, am I right that, like you said, low carb, intermittent fasting? Like we just had, I just had Austin Herbert on a while back, and he was talking about that and like insulin and if you eat single ingredient foods, if you walk 10,000 steps, if you have intermittent fasting, that 8-hour or 16-hour 8-16 kind of intermittent fasting, and you can reduce a lot of diseases on your own, a lot of the autoimmune diseases. Like lately I've turned into a big old seed oil disrespecter as well. I don't know if you have that going on, but you mentioned earlier, or you mentioned something that made me think. There's also the aspect in CrowdHealth of the reputation score. Do you care to describe that to the audience?
Yeah, in essence, what this is we want to act like a community, and we all know the communities that we're in, the bad actors and the good actors in the community, and nobody wants the bad actors in the community, right? If the guy next door parties all night, every night, and blares music into your house, when they come over and are looking for, butter or something that they forgot, like I'm less likely to have butter if it's somebody who's, a really terrible neighbor.
Yeah.
And so we do something similar in CrowdHealth where it's, we show people, how often you've given, and so if you've, for the last 10 times have said yes, 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 then the probability of you getting funded is really, really high. Now, if you said no, 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 the probability of you getting funded is almost zero. And so, we keep track of that. We show that to people when they have the ability to fund you, and all these fundings are voluntary. So you can say no, and over 1,000 times people have either said no or their credit card payment has failed or something where they weren't able to, actually help somebody else out. And of the 13,000 bills that we've gotten, I think it's almost 14,000 now. Only 2 have gotten rejected by the community or unfunded by the community. And both of those were pretty small bills. I think they were a couple $100, something like that. But both of these people who reached out and wanted the crowd to help, had said no, like the last 5 or 6 times to other people when they reached out. And so the community was kind of like, okay, well, I'm not helping you. And so it is a very good kind of reciprocity engine that drives this. But, look, the reciprocity engine drives a lot of what we do in life, right? It's if you treat somebody like crap, don't really expect them to help you out when you need help. So let's go and love each other really, really well, so that when we do need help as fellow community members, then we have people there who to help us. I mean, it's just kind of how the world works.
I love it. It's the positive incentives coming back.
Yeah,
You put
totally.
positive incentives in, and they come out.
Exactly.
I got to ask the tough question. I
Sure.
know it's been a while. One of the incentives for me starting off was having the Bitcoin account.
Yeah.
Now, I know that went away for valid reasons. Is that something that it might come back in the future? Working with Bitcoin, Lightning, whatever.
Yeah, absolutely. I mean, look, my two passions, or work passions, I should say, is healthcare and Bitcoin. And so I'm trying to figure out ways that we can increase the utilization of Bitcoin as not only a store of value, because I think that is one good component of it, but I think, ultimately, if I think the dollar is going to fail, I need a way to transact in Bitcoin as well. I also think that the government doesn't want Bitcoin to succeed. And therefore, I think Bitcoin circularity, basically meaning you can keep Bitcoin in the system, you can get paid in Bitcoin and pay other people in Bitcoin, is really important, because the federal government does control the banks. And so all that to say is, my vision is for all of us to be paying our healthcare expenses in Bitcoin. And we're going to be using the Lightning Network. And so what's going to happen is you're going to sign up. And by the way, this is just for the Bitcoin community. So if there's any non-Bitcoiners out there, don't get freaked out. We'd love for you to join the Bitcoin community and learn about it, but it's more just for the people who want to, invest in Bitcoin. There's still a dollar denominated group too. You're going to sign up, you're going to start a wallet, it's going to be, self-custodied. So you're going to have your kind of seed phrase. I'm then going to reach out to Tim, and I'm going to say, hey, Tim, Andy needs help. Will you send him X number of sats? And you can say, yes or no. And then, you can actually it's going to send you an invoice. You're going to send the sats directly from Tim to Andy. And then I'm going to have enough sats to pay for, let's just say I have a $5,000 surgery, whatever that is in sats. I'll have enough for that sats. And then I have a decision to make. I can either keep the sats in my wallet and let them increase in value, or I can convert them to dollars and pay my doctor in dollars. Or ultimately, what I want to be able to do is be able to take those sats directly from my wallet and pay the doctor in sats, because he wants to transact in Bitcoin too. So what we're currently doing is building the infrastructure to do that. We're building finding doctors who would like to take money, or take their proceeds in sats. And so we've got a full-time person who's out there just looking for Bitcoin docs. And so that's kind of what we're doing. And I mean, if there's a chance we can have that on a kind of a May 1st start. It may drop till a January 1st or a June 1st start, but we're in the final kind of pieces of this, putting it together. It's, for those who know Bitcoin and Lightning specifically, developing on it is a challenge. They don't have all kind of the cool bells and whistles that we have in I hate the fiat world, but there are some things that make life a little bit easier. It's going to be, one step harder to do this than other ways, but Bitcoiners are willing to take one more step to do things that are right, as opposed to just going with the flow and being a lemming.
Well, one thing I love about that is that you're not just, it's not just Bitcoin from the customer perspective, but Bitcoin from the merchant perspective.
Yeah.
Bitcoin from the doctors, Bitcoin from, because I was just talking yesterday with Shannon Beyer, the Columbus Bitcoin meetup host. And that's his biggest thing. He's like, his biggest prediction is that adoption won't come as much from the consumer, from retail, as much as it is from the merchants. They're seeing their bottom line just continue, the melting ice cube
Yeah.
concept, right? Um, my apologies for not knowing, but does CrowdHealth have Bitcoin as a treasury asset, or is that a conversation?
A little bit. I think that what I always tell people with Bitcoin is like, look, if you need this money in the next year or 18 months,
Right.
like this may not be the right place for you to put it. Because I think I want to ever be very, very clear. I think my Bitcoin is going to be worth many, many multiples in the next year, 2 years, 5 years.
Mm-hmm.
However, I think there's an equally likely chance in the short term it gets cut in half. Like, I think there's going to be some volatility still, and that doesn't
Yeah.
mean. And so when I put my money into Bitcoin, I look at it as a 5 to 10 year time horizon, and maybe even longer than that, candidly. And so when I have a startup that says, "Hey, I want to put my Bitcoin into and have Bitcoin in my treasury," I'm saying like, look, just you've got to acknowledge the fact that that money could get cut in half, right? And when you're running a startup, cash is king. And so, yes, while you're losing value of that fiat in a bank account is not going to, it's not going to get cut in half in the next year.
You need to be nimble.
You need to be nimble. You need to be nimble. And so that's a long way of saying like, look, don't be dumb with your treasury in the short term. Buy Bitcoin for the long term. And startups are ones where we need to survive the next 3, 6, 12 months.
That makes sense.
Fortunately for us, we will be profitable. We have plenty of money in the bank, and we will be profitable in probably June or July. And so we won't be burning cash anymore, so we won't need the cash as much. And so then you have a conversation of saying, okay, what is the best use of capital here? And you take a MicroStrategy approach, which is like, hey, the best place to store my cash, especially if you don't need it for the next year or 2 years, is in Bitcoin. Don't let it sit in T-bills. That's ridiculous. Like sit it in. So if you're burning cash, keep cash. If you are profitable, then I think a significant percentage of your treasury should go to Bitcoin. That's the way that I look at it as a business owner.
Nice. I dig that. I respect that. Yeah, we all can't be Michael Saylor's having his 100-year time preference.
Yeah. I mean, for a startup, 3 months is like 5 years. I mean, it's just like the time frame is just totally condensed, right? And so I gotta make sure that I survive, for the next year or two, and not to scare everybody. I mean, we got plenty of cash. We're burning about $50,000 a month right now for the next 3 or 4 months, and I have almost $2.5 million of cash. So I got plenty in there to make it till we get profitable. But we keep that a little bit just because of we're having some regulatory intervention. We have governments who don't want us to do this. We got there's always things that pop up in the short term that could make things challenging.
Well, I love the fact that you're building the future you want to see, and that's it costs a lot. It takes.
Yeah.
As my father always told me, it takes money to make money.
Yeah.
And
it really does.
Do you have anything else on the horizon for CrowdHealth that we haven't discussed? Where do you see this going in the next 1 to 2 years?
Yeah, what we're doing on the back end is we've got an incredible amount of data now. All of our members, like I said, we have 13 or 14,000 bills that we've processed. So we got a lot of data, which I'm trying to put into a format that can help others. So, for example, if you're looking for a colonoscopy in Austin, Texas, there are 50 other members that have gotten colonoscopies in Austin, Texas, and so I would never tell you who those people are for privacy reasons, but I think people can find the fact that I got a colonoscopy for $800 and somebody else got a colonoscopy for $1,500, and this one was a great experience. That one was a bad experience. Like being able to share that data within kind of in a private way, I think is really important. I mean, you mentioned it earlier. We just don't know how much healthcare costs, right? So if I had
always growing.
Yeah, if I had some data to help you understand what your bill should cost, I think that's going to be helpful to our community. So that's a big one. We also are working on something using again that data. If you submit a bill to us, are going to soon be able to generate a report that says, hey, these prices are good, these prices are bad. These prices or this procedure has nothing to do with your condition. So why is that even in there? And so in essence, what we're going to do is trying to create transparency around these bills that look like crazy town. I mean, just a quick funny story is I went to Stanford. My roommate was the number 2 person in our class at Stanford. And he's like, there's nothing that makes me feel like an idiot in this world except health insurance bills.
Ditto.
Right? Like, this is a wicked smart guy. And he's like, I feel like an idiot. I have no idea what's going on with these bills, you know? And you're just like, I want to build a functionality where you can insert your bill. It's going to spit back out to you. Like, this is what all this means, you know? And we've got enough data now where we can, train up a model to show people what that is. And I think that's super valuable. And again, look, privacy is my number one thing. People are data is going to be private. I'm not monetizing it. I'm just giving it back to people so that you can actually use it. And as a result of that, your monthly price is going to go down because people are going to be more educated about what they should be paying, as opposed to going and getting a $5,000 colonoscopy, which is what it costs in a health insurance plan.
I mean, food is physical health. Information, data is mental health. It's making me smarter, and also in the process making bills go down. What a crazy idea!
Yeah.
Andy, I got one more question for you, kind of a prediction.
Yeah.
Are the St. Louis Cardinals going to be over 500 this year?
Yeah. Well, over 500. I'm going to give them over 500. Yes. I will say over 500. I'm a huge Cardinals fan. Yeah. The owner of the Cardinals was an investor in my last company.
Oh,
so
nice.
I've gotten to know them a little bit. I'm a diehard Cardinals fan all the way back to the 80s with, Willie McGee and Vince Coleman and Ozzie Smith and all those guys. So they will be over 500. They will not be competing for anything this year, but let's rebuild it.
At least we got somewhat of a semblance of a pitching staff now.
Yeah, exactly. Last year was an absolute disaster from that perspective.
Well, aside from that, Andy, I thank you for sharing all your information. Thank you for what you're doing. I'm looking forward to staying with CrowdHealth and continuing to grow with them. I love everything you're doing. Feel free to come back on the podcast anytime. And I look forward to seeing you in Nashville.
Yeah, it should be fun.
All right. Andy Schoonover, thank you for joining me on Zoom Out.
Thanks, Tim.